Hello. Good day, folks, and to all listeners out there. Thank you very much to our very nice short video presentation by our Swiss headquarters of the FIM. Thank you to the IT department as well. Good day to all listeners and stakeholders, friends out there listening. We are all locked up in our houses except for some countries, and on behalf of FIM Asia Continental Union, we would wish to welcome you to this webinar. It's regards to this new invisible enemy we have now, the COVID-19. Its implications to our motorsports, which finds us at home, and as well as the serious condition we find our society in. At these current times, in our norms and way of living has changed. It is the duty of the FIM Asia as the governing body to make some information dissemination drives and guidelines to provide our members, teams, promoters, circuit owners, and stakeholders the future of motorsports. Of course, there's no solution at the moment. The FIM Asia was first alarmed at the end of January. We had some circuit inspections to do in China. And unfortunately, the rumor of the virus has spread, and our colleagues said, put a hold on this inspection in order to observe the situation. Unfortunately, it wasn't called a pandemic yet, and the institution based in Switzerland has not declared it yet. They were busy doing something else, the World Health Organization, probably. The FIM Asia has launched the FIM Asia Cares program. It is part of our corporate social responsibility project, wherein we have already donated to 45 countries globally. We have given them virus testing kits and other virus products. Of course, we would wish to thank our colleagues in the Macau Federation, the AAMC China, for their kind contribution to our program. We also have delivered to the top 5 hits of the virus, namely USA, Italy, Spain, France, and Portugal, as well as our 28 FIM Asia member nations and other stakeholders and colleagues in our FIM Asia family. We hope other institutions shall follow suit as we find ourselves in this crisis, and they may contribute as well. Some federations are already assisting locally in their own communities to fight the virus in their countries, in their own ways. And we in the FIM Asia and FIM recognize you for this, and it is much appreciated. The fact that one of our contributions could save even one life will make all our efforts worth it. This situation calls for a crisis management plan at the moment. In our races, our race control, jury, and stewards, we do have a crisis management code. This was just passed in the FIM Asia General Assembly last January in Macau. And this manages any crisis that happens in the events, wherein we already have this in place for some events. Unfortunately, this type of crisis changes week by week. So it is very difficult to have a crisis management plan because we don't know our next few steps. In each crisis, we should identify the strength, the weaknesses, the opportunities, and threats of the current situation you are faced in order to formulate a management crisis plan solution and the next steps to be taken with this planned scenario A, B, C, D immediately for future of our events. Our promoters and organizers and circuits find themselves in this precarious situation at the moment. We cannot produce solid calendars, and everything is up in the air at the moment. But be optimistic, and we hope in the last 4 months of this year, the show and life will go on. Current situation, we ask ourselves, for example, shall we host events without spectators? Why not? Because times have changed, and utilize our television and social media promotions for this. But the most important, which we should take note, is each government has their own local policies with regards to events, as well as quarantine procedures for international travel of delegates, as well as national events to arrive in their countries. This we must respect, and unfortunately, this complicates our sporting events more. In continental championships, we have around 15 to 20 countries coming over. The circuit is composed of 200 personnel daily working. The pit area and paddock with riders and their crew number to around 300 to 500 for the continental and world championships event. So this is still quite a size of a number. Local organizers or circuits or promoters should coordinate with the local sporting authority in order to ask permits. Very important in this is that to inform the authorities that we shall take precautions towards the virus, namely athletes are checked every week, maybe a phone application of their health and their locations are being tracked by the organizers. This we can find out more in the future. We can talk more of the aspects of our virus to our motorsports in the current situation. Our good friend, Dr. David McManus from Ireland. He is an icon in the FIM. A very nice chap. I don't know if he's from North or South Ireland. Oops. So David, thank you very much. David also is part of our director of the International Medical Panel of the FIM. He is our CMO in many of our FIM World and Prize events. And to extrapolate further on this virus concern for the family, after Dr. David goes on, I shall get back to you for a conclusion, so please stand by. And take note, if you have any questions, we may ask Dr. David through our chat box. And David can answer this then after. So from the Philippines, maybe pass the screen to Ireland. Doctor.
Thank you very much, Mikey. I'll just try to share my screen here. Bear with me. Yep, there we go. Okay. So, good morning or good evening, everyone, depending on where you are. Thank you for joining us. Really, the title of this is the medical implications for motorcycle sport, and I want to present some of the background about the current pandemic and the virus and the associated illness, and how we prevent it, and lead us into, following that background, how that impacts on our sport. Now, I realize that there are a lot of people in the audience from a variety of backgrounds, both medical and non-medical. So I'm aware that some of the doctors will already know some of this stuff, but we have a range of people from the FIM, various national federations who are involved in the management of the pandemic, the response to the pandemic in their various countries, and also those who are involved in the organization of our events. So I will commence first of all with the virus. This is the virus, so-called coronavirus. To give you its proper name, it's SARS-CoV-2 is the official name. So-called coronavirus because of these little protrusions or spikes that look like crowns. Nothing to do with coronavirus or corona beer, I can assure you. So if I look in the virus in a little bit more detail, I just want to point out a couple of things. These spike proteins are quite important in the virus actually gaining access to cells in the body. And it's also what the vaccine will be designed to bind to. The S protein seems to be common across the various strains. So lots of work going on in that regard for the moment. But the other part is this envelope, this lipoprotein envelope. And it is quite crucial and important that we have been advised about washing our hands and using alcohol sanitizers and so on. I'll come to those in a bit more detail, but those things, simple soap and water and alcohol, will actually disrupt this envelope, this membrane, if you like, to allow exposure of the RNA, the nucleus of the virus, and once it's exposed, that's what kills the virus. So that's quite an important picture, I think, to have in our heads. So if I can get this to advance. Yeah, there we go. So thinking of the illness itself, there are a lot of symptoms, and as our knowledge of the virus grows, remembering that this is a novel virus, a new virus, we've never encountered it before. There are other coronaviruses that have been in circulation for a long time. They cause upper respiratory tract infections, colds, and forms of flu. But this is new. It only appeared probably around December. And as a result of it not being encountered by humans before, there is no immunity to it, and hence the concern regarding the spread of the illness and the potential severity of the illness. And I've listed in this article, or from this article in the British Medical Journal, the clinical characteristics and the symptoms, and you can see that the most common symptom is a cough with temperature, sometimes quite high, then tiredness, sometimes the production of some mucus, some sputum, with shortness of breath, muscle aches and pains, sore throat, and so on. And the doctors among us are aware that we are always looking for those patients who may require hospital admission, and those are the patients with very high temperatures, but in particular quite marked systemic infection, and especially those who are developing the associated pneumonia with this, and the difficulty breathing, and the associated drop in the level of oxygen in their blood. Most cases can be managed at home, but we're always on the lookout for these very severe cases. So looking at how the illness will progress, and this is from an article by the Imperial College London, and from first symptoms, the cough, the sore throat, the fever, the tiredness, myalgia is the muscle aches and pains, to in and around towards the end of the first week of symptoms, a lot of people who have been managing themselves at home will seek medical advice. And people will then start to improve, or as they get into the second week of the illness, they may deteriorate, and that is when the hospitalizations tend to occur and the diagnosis of the pneumonia is made. And if the patient then recovers after, in some cases, quite intensive treatment, it may be another couple of weeks before they're finally well enough to be discharged from hospital. Putting that into a timeline in terms of days, this is from the Lancet, you'll see on this timeline that the hospital admissions that I've said tend to occur in the second week. So if patients are going to get really sick, that's when it tends to occur, and they become short of breath and systemically unwell. They develop this ARDS, which is the abbreviation for the acute respiratory distress syndrome. And then during that second week, if they require intensive care admission and are seriously ill, that's when it tends to occur. However, that having been said, I think it is very important to stress that most people who suffer from COVID, which is the name of the illness, COVID-19. The virus is coronavirus, and the illness that it causes is COVID-19. Just to make that distinction, the two terms tend to be used interchangeably in the media. But it is important to emphasize that most cases are mild. The experience in China has been that 80% of the cases are mild. And these figures are from an update provided by the European Centre for Disease Control. In the media, and certainly here in the UK and Ireland, every day there is a briefing with the Chief Medical Officer and senior ministers from government. And the focus there is every day reporting the unfortunate and tragic deaths from this condition. And I think it gets lost that most people who contract the virus and are ill because of it actually recover. Only 14% go on to develop severe disease, and 6% experience a critical illness requiring critical care in intensive care. And this is also the experience in Europe, with only 30% requiring hospitalization and 4% of cases requiring critical care. So I think it's important to keep this in perspective. I understand the anxiety around this relatively new illness, and experience and learning is growing as almost on a daily basis. But I think it's important to provide some reassurance in this regard, not to minimize in any way the potential for the severity of the illness in some cases. Now, there are some risk factors which are associated with the severe illness that make it more likely that someone who contracts the virus will suffer a severe illness. So age, in the United Kingdom, it is 70 years. If you're 70 years and above, it is recommended that you are shielded from public contact because of the risk. Gender seems to be an emerging thing. This is not a good time to be a man because men feature more commonly in the statistics, are more likely to get the infection and get it severely than women. Weight, being overweight, appears to be a significant risk factor. And your level of physical fitness before you become unwell is also emerging as a significant factor. If you are fit, it improves your chances from recovering from the significant illness. And recently, some attention is being given to ethnicity, as some ethnic groups in various countries seem to be much more affected than others, but that work has only recently just started. Importantly, there are a lot of associated conditions that increase your risk. And I've listed them there in no particular order, but it appears, having just checked a recent update as recently as yesterday, that diabetes and hypertension, as well as chronic respiratory disease, seem to be fairly key factors in this. So what do we do about this illness? You'll all be familiar with this curve and the term that is used, flattening the curve. And for those of you who are maybe not aware, I just want to explain this to you. So along the bottom, we have time. And on the side, on the vertical axis, we have the daily number of cases. So if we do nothing in terms of prevention and suppression of this, you get a huge peak in cases. And the concern here was, and is, that the healthcare system's capacity would be exceeded, and that health services would be overwhelmed by the number of cases. With protective measures, what they are attempting to do is to lessen the peak so that it remains below the capacity, within the capacity of the healthcare system to cope in particular with the number of people who may develop serious, indeed critical illness. So that is what all these measures that to a greater or lesser extent that we're in the middle of is to do, and that is to reduce this peak. Now, an effect of reducing the peak that you can see here is that it prolongs the period of time during which there are significant numbers of cases, and that is important for us when we consider us resuming our sporting events, because the virus will be with us for a bit longer. The other thing that is becoming apparent is that these curves are not symmetrical, and it appears that the downslope is not as steep as the upslope. Therefore, the reduction in cases will be slower and in a more stepwise fashion, and we'll keep an eye to that. So what are the prevention and management measures? Well, prevention is always better than cure, and it's the old medical saying. And so simple things are found to be very effective. Hand hygiene, in particular, washing your hands frequently, the use of hand sanitizers with alcohol, and in particular more than 60%, ideally 70% alcohol, with respiratory etiquette, as it's known, in how you cough and sneeze. And what has also emerged since the beginning of this, the general hygiene is very important, because the general hygiene of the environment in which you are, particularly surfaces that are touched, should be disinfected. And also it is now known that the virus will persist in the urine and the feces of patients for some time. So personal hygiene before eating and after using the toilet is also very important. Then we have the social isolation and distancing, leading to the various lockdowns of varying degrees across the world. And then the PPE, which is short for personal protective equipment, including masks. And I propose to briefly go into a bit more detail on those. So the first thing is we don't touch anyone anymore. No more handshaking, no hugging, no kissing. We'll just smile or wave or nod or bow to people, but we'll avoid physical contact, which in a lot of our cultures is very difficult to do. Then washing our hands. So wash your hands minimum 20 seconds using warm water and soap until they are visibly clean, or using an alcohol-based hand rub. And you can see on the right side of my slide one of the hand washing graphics that we use in our local ambulance service, where we encourage our paramedics to wash their hands for 45 seconds using the alcohol sanitizer or soap and water, and they use an almost surgical scrub up technique to ensure that all parts of their hands are clean between their fingers and both the front and the back and up beyond their wrists. Now, this has been proven to be incredibly effective, and in countries that are predominantly Muslim, it is recognized with hand washing 5 times a day as normal prior to prayers, that the incidence of infection is lower. And there are many other studies that have confirmed the significance of this very simple technique. I mentioned respiratory etiquette earlier, and effectively this is the catch it, bin it, kill it routine, where if you're going to cough or sneeze, you do it into a disposable tissue, cover your mouth and nose. You then bin it, and then you wash your hands. If you don't have a tissue, then you cough or sneeze into your elbow, as shown in the photograph, particularly when you're out in public. Then moving on to the social isolation and distancing. There is another element of this which is known as shielding, where people who are particularly vulnerable with underlying medical conditions or the elderly are recommended to actually be shielded. That is, they isolate themselves for the duration of the pandemic. But others, if they're symptomatic, should go home and stay there. And it's even recommended that they should distance themselves by 2 meters from the members of their family in their own household. That is a very, very difficult thing to do. And then depending on whether other family members develop symptoms, that isolation can go on for anything up to 14 days. In the United Kingdom and Ireland, it's recommended for 7 days, but that is now felt it should be 14 days. Now, social distancing, which we're all involved with now with the current restrictions imposed by many governments, is incredibly significant, as this graphic shows very well. This is actually quite conservative in that the top part, where if you have one person with the infection, infects 2.5 people, and in fact the initial figures show the N number, as it's called, would be anything from 2.6 to above 3. But if we go with 2.5 people infected, that in 30 days leads to the infection of over 400 people. If, however, you reduce the social contact by half by distancing or isolation, you reduce that number to half. So in fact, only 15 people, because of the logarithmic spread of this, only 15 people are infected in a month. And if you go further and reduce that by 75%, then only 2.5 people are infected. And I think this is a very powerful graphic to demonstrate how important the social distancing and social isolation is in this. And in many countries, we can see the benefit of all of these measures together in reducing the peak of the curve as was intended. Now, that's kind of on the positive side. However, the social isolation does have a significant number of adverse effects: physical, mental, economic, and so on. And I've listed just some of them. And some people, and we know, are having great difficulty in dealing with this. There are physical health consequences to this in chronic disease exacerbation, and indeed the increase in acute medical events such as heart attacks and strokes, and all the other things like reduced fitness, weight gain, and the risks with that. Moving across to mental health issues with loneliness, stress, anxiety, depression, alcohol misuse. I heard a figure this morning that here in Ireland, alcohol sales have gone up since the lockdown began by over 30%. So this is a real issue. We cannot continue this for any longer than is absolutely necessary. We have to return to normal. There are immense economic costs, not just to the government and the country's economy, but also to individuals who may have lost businesses, lost jobs, lost income. And so this is very significant. And so governments now are looking to ways in which they can reduce this. And I would also have to say that I do believe that returning to sport is a very key factor in dealing with this. I've listed some management options in terms of maintaining a routine, keeping your motivation, keeping your mind and your body occupied. Physical, mental exercise is essential, and maintaining social connections using technology such as we are using today. And mental health services in many countries are really stepping up here and making it easier for people to access their services online. But I think sport has a major part to play here in getting us out and occupying our minds and keeping us physically fit and we can play our part in this, providing we do it appropriately. Now, the other thing will be PPE, but before I get on to that, just to say that there are lots of resources out there. This happens to be from the World Health Organization about the issues of stress in adults and children during the pandemic, and there are lots more materials and services available online for this, and these are all available for download and distribution. So I've talked about wash your hands, using tissues, and importantly, avoid touching your face. Now, the virus enters your body through your mouth, your nose, or your eyes, primarily the mucous membranes. And so that's where the personal protective equipment comes in. Now, this is from Public Health England, and even in a medical setting, there are different levels of personal protective equipment. On the left, this is what's recommended for people dealing with cases of COVID, but in intensive care units or in ambulances or in emergency departments where there's a possibility of what's known as aerosol generating procedures. The virus is spread in respiratory droplets by coughing and sneezing, but finer particles at higher risk in what doctors and nurses do that generate these aerosols. Requires a higher level of PPE. And in fact, this is me. In my PPE, while the staff in the office in Geneva are working from home and there are no events, I have been supporting the ambulance service where I used to work as their medical director. I've been helping out with their response and providing clinical support and clinical supervision and the development of some clinical protocols. And this is the personal protective equipment that we have to use, which covers our eyes with the visor, covers our mouth and nose with an FFP3 mask, which is a higher level of protection than a normal surgical mask, our gloves for hand protection, and our head and our body and our feet are protected in a disposable suit. So thinking about this in general terms, gloves. We wear gloves as part of our work, but it is actually recommended that members of the public who are not involved in healthcare or in the direct care of a person with the infection, it's recommended that they don't wear gloves. And the reason for that is quite straightforward, in that if you touch something with your gloves, there is a tendency to touch your face at some point, almost subconsciously without knowing you're doing it. And if you touch a surface and then you touch somebody else or you touch another surface, you can spread the virus if it's there using the gloves, whereas you can wash your hands. And so the recommendation is washing your hands often, so gloves tend to reduce the frequency of that because it lulls people into a false sense of security. So that's the first point. Then the important issue of masks. Do we wear them? Do we not? And that is something that is emerging, and I know that some governments have recently, I think I'm correct in saying that in Germany the government have now mandated their use in public transport, and in other countries their use in public is compulsory, but that's not the case in other countries. So if I refer to the World Health Organization and their current advice on when to wear a mask, they are suggesting that it may not provide much benefit to members of the public. The evidence for benefit is weak. However, it is now felt that in some circumstances that wearing a mask may in fact be beneficial and outweigh the risk. Thinking particularly in those environments where you cannot socially distance, For example, in public transport would be an example of that. The workplace would be another example. But there are other issues with the mask because if the public start to wear masks, it may lead to a shortage for healthcare providers. But if you're going again to wear a mask, it needs to be of the correct specification for you. It needs to fit so that you're not breathing in air from the top of the mask, the bottom of the mask, or the sides of the mask, but through the mask. And the real benefit seems to be if a person who is ill is going to be going out to protect other people from their coughs and sneezes, as opposed to protecting people from others, if you see what I mean. So it's felt that people who are symptomatic should wear masks to protect other people. However, I think this advice is changing, and as I say, various governments are mandating their use. But if you're using a disposable mask, it is essential that it is disposed of properly, that it's worn properly and fits properly, and that if it gets damp, it is changed, because viruses love warm, damp environments to multiply. So you could be making the situation worse. And you clean your hands before and after using the mask. And the key piece of advice here is don't touch the front of the mask. The other issue is, and people forget this, is that the virus can enter your body through your eyes, and the mask does not protect your eyes. It protects your mouth and your nose, and you see a lot of people wearing masks on the tip of their nose. It has to go up as high as the bridge of your nose, up here where my glasses are sitting. And this is one of our paramedics in the ambulance service demonstrating how to remove a mask. And you can see he does not touch the front of the mask at all, disposes of it immediately, directly into the waste, and immediately cleans his hands. But there's a huge education to be done out there on the proper use of masks. And again, there's lots of graphics that are available for people. And these are the sorts of things maybe that we need to consider for our events in the near future, if we resume, or if and when. So just briefly, I want to cover some of the potential treatments and just deal with some other issues that are out there. So there have been lots of proposed treatments for the COVID, none of which are proven. And there are two studies that have commenced very recently, two clinical trials, fairly significant clinical trials, using combinations of these various drugs. Solidarity is being run, the Solidarity trial is being run by the World Health Organization, and the Recovery trial is being run by Oxford University, using combinations and variations of these four drugs. The one at the top, remdesivir, is an antiviral that was developed for the treatment of Ebola, and it seems to be having an effect. And there's a recent report from Chicago that seems to suggest its administration markedly shortens the time that patients remain on ventilators, and that's being further evaluated in these studies. There's been a lot of discussion about chloroquine and hydroxychloroquine, which are used for the treatment of malaria, because of some of the theoretical considerations in terms of the way it works in malaria. It may help in treating the virus. However, there is no clear evidence of this, and I think we need to be careful, because certainly one trial that was done at normal dose showed not very much benefit from this, and one other arm of that same trial, which was using high dose hydroxychloroquine, had to be stopped because of the very significant cardiac side effects with the high dose of the drug, and so patients couldn't take it for long enough. So I think we need to be careful. Then there are other combinations of antivirals that are used in the management of AIDS, low-dose steroids, anti-arthritic drugs to suppress the immune response and reduce the so-called cytokine storm, and even some antibiotics, and recently being trailed in the media, the use of blood antibodies from patients who have recovered from the illness. But all of these are currently being evaluated in quite large clinical trials globally, and we're not in a position to make a definitive statement about what treatment should be used. If we move to the right-hand column, there's been a lot of discussion about various things. I'm not going to go through all of these things, but there are a couple I just want to highlight. The ACE2 inhibitors, the virus seems to get into cells using the ACE2 pathway, but there will be a lot of people, maybe some in the audience, who are taking ACE2 inhibitors for high blood pressure and with diabetes and so on. And there was a theoretical consideration that if you were inhibiting this pathway into the cells, that this would worsen the illness. Emerging evidence looking at this and looking at studies suggests that that's not the case, and that you should continue to take your medication. And again, the ibuprofen, just about a week ago, there was a review article published by King's College in London, which showed that there is no convincing evidence that taking ibuprofen or other anti-inflammatory medication actually increased the likelihood of you getting the illness or suffering a more severe illness. Paracetamol is preferred management of your fever and pain, but if you're taking ibuprofen, it's now felt that you should continue to do so. There were some initial suggestions from France that this could be harmful, but that's not supported by a review of the evidence. Now, alcohol. If alcohol kills the virus when you use it to wash your hands, this is interesting. Some people postulated that if you drank it, it would stop you getting the illness. This, in fact, is not true, I'm sorry to say. But thinking about alcohol, which is interesting, the 60%, 70% alcohol seems to be more effective than 100% alcohol. And it seems to be effective if you put it on your skin, but not if you drink it. Do not start drinking alcohol. It'll cause you other problems to worry about other than COVID. I've actually been asked about the ultraviolet light disinfection. Now, there's some discussion in the media about the seasonality of the virus moving forward because of sunlight during the summer may reduce the rate of infection. I don't know. But in terms of disinfectant using ultraviolet light, I think there are a few important points to be made here. Ultraviolet light disinfectant has been used in medical facilities and for medical equipment for some time. It's ultraviolet C. It's not ultraviolet A or B that you get from sunlight, but this is like a man-made form of ultraviolet light. And it's actually very harmful to humans. So the disinfection occurs when there are no humans about. So if a machine is put in a room, then everyone must leave for the period of disinfection. And the other thing is that the room or the equipment that are being disinfected with ultraviolet light need to be chemically disinfected first. They need to be cleaned and chemically disinfected and then subject to the ultraviolet light. There's a lot more kind of detail to that, and the machinery to do this is actually very expensive. So just going and buying a kind of ultraviolet bulb that you would put in a light socket will not be effective. And there's a list of other things, but time will not permit us to go into those in detail. So looking to the future and coming to our sport, this is another version of the curve that I showed you earlier. And so we have the first peak that we were putting all these measures in place to try and flatten the curve so that we reduce the peak and hopefully keep the number of cases within the capacity of the health service to deal with them. And as I mentioned earlier, that lengthens the time that the virus is about. However, in previous pandemics, be it the H1N1 or the Spanish flu or other pandemics, there is usually a further peak and sometimes a third peak. And this is vexing a lot of people dealing with this at the moment, is how do we lessen the social restrictions in a way that will reduce the peak of the second phase of this. Now, this is important because if we're going to resume our sport and have events whenever, we need to realize that there will still be virus around and be cognizant of that and to pay attention to it. It will not just suddenly disappear. And we need to monitor the situation because the number of cases may rise again. And in fact, this may happen early or it may take to the autumn. No one quite knows. And so there are lots of very clever people who are monitoring this. But when we resume our sport, and I hope that will be soon, the virus will still be circulating. And in fact, it may become part of seasonal flu, who knows? We're unsure of the degree of immunity or when we'll get a vaccine. Therefore, we have to remember that when we resume our sport and our events, that the virus will still be circulating. So the easing of the restrictions will be followed by a lot of testing in a lot of countries to identify cases, to get back to contact tracing in huge numbers and quarantining cases to reduce that second and possibly third peak. And as I've said, until we get effective treatments or identify effective treatments and have a vaccine, the virus will be around. And so we cannot just assume that reorganizing our calendars to whenever is enough. We have to think in terms of the potential risks associated with the virus. So moving finally into our sport, I think there are a number of things that we have to consider, and I think these are important. We can adjust our calendars for sure, and certainly those of us in the FIM have been receiving a lot of information about events being postponed, some cancelled, others rescheduled, and that is fine. And I look forward to meeting people again at the earliest opportunity at our events. I think we need to consider, and Stephen mentioned this in his opening remarks, we really have to liaise with national and local governments where our events will take place to see if they're okay with us having the event and what their requirements are. And we also need to liaise with those national and local health providers and public health agencies to see what the restrictions are, what they are not, what the requirements are for face mask wearing and so on. Travel, as we all know at our events, is extremely important, where we bring competitors, participants, officials, teams from all over the world arriving in a country. And we really need to be communicating with these participants in advance before they travel so that ill people are not traveling to our events. And consider what we do if someone who is ill arrives at an airport or arrives at our event. How are we going to maintain or arrange for social distancing at our venues? And what about surveillance and monitoring at the events? Are we going to scan for high temperatures, for example, coming to the track or the circuit? What arrangements are in place if someone becomes ill during an event? So I think in advance we have to consider what are the risk factors here and what are the mitigations that we can put in place. And this is not an exhaustive list by any stretch. We need to consider facilities at our event. Social distancing, again, as was mentioned in the opening remarks, for the riders, for the teams, but also for the officials. So do we separate the public from the riders in the paddock? Do we stop the public coming into the paddock and getting up close to the riders, which is one of the big attractions of our sport? Or do we stop spectators and fans coming to the events at all and have them behind closed doors? I don't know. I'm only posing the questions for consideration. I think we need to do a discipline by discipline, event by event assessment. Thinking of officials in race control room, where normally we're all sitting immediately beside one another. Do we have the capacity or the facility to separate ourselves? And the same in race direction meetings, jury meetings, and so on. Then the all-important issue of the hygiene facilities, the provision of hand sanitizer, masks, disinfecting frequently touched surfaces, door handles, and so on, the availability of bottled water, preferably, as well as towels and tissues, and then how they are disposed of. Now, I don't want to appear negative, quite the opposite. I think if we think about these things in advance and can show that we are considering them and are looking to put mitigation in place to manage any risks, I think that will enhance our reputation as taking this issue seriously. And I think it will increase the likelihood of national and local governments letting us go ahead with events rather than just sort of turn up at an event and pose a risk which would have an adverse effect on our reputation as a sport and as organizers and as a governing body. So I'm as keen to get back to the sport as all of you are, but I think we have to just stop for a moment and think about this and prepare in ways that we wouldn't have necessarily before. And thinking specifically of medical service provision, I think we have to think about the impact that it has on the local health service provision. And there are two ways this can happen. One is the numbers of doctors, paramedics, nurses, ambulances, and so on that we require for particularly some of our larger events, and the potential adverse effect that this may have on local health service provision in the area. And similarly, if we're going to send potentially some ill and potentially seriously injured people to hospital, that may also put additional pressure on an already stretched local health service. So I think we have to liaise with these people in advance. The medical service personnel at the event need to be aware of the clinical protocols and the personal protective equipment that is required now in this present situation. And all this is eminently doable. And then what happens if somebody gets sick? Do we know what to do? Do we have the facility to isolate them somewhere and then arrange quarantine and transport, appropriate transport to a facility that is actually accepting patients potentially with the viral infection, and then ultimately repatriation, given some national quarantine restrictions on returning citizens. So I say this to be positive because I think if we hit the ground running with this and consider these issues, then I think we can hopefully get back to some sport sooner rather than later. So please think of these as being helpful measures to take, and positive things rather than obstacles. And so I think just really to finish before we take questions, I have just kind of listed some stuff there. It's not exhaustive, it's not complete, but there are guidelines available. For example, this is a screenshot of one from the World Health Organization for sports event organizers, for planning mass gatherings and sports federations such as ourselves. And they contain guidance, they contain risk assessment tools and decision-making tools, and these are also available from various national and international centers for disease control. And so I would commend them to you, and I've included the references for this one on the slide. If you wish to review it and access it, I would commend it to you. So I think that brings us to the questions, I think. Now, there were some that were coming in. Yeah, here we are. Okay, so I'll take a glass of water. Unfortunately, I'll have to answer the questions verbally because I can't type fast enough. So if you can put up with me speaking for another few minutes. So first question is, any chance to share post-pandemic FIM plans, examples for marshals? Yes is the short answer to that. We need to work on them and finalize them, but my suggestion would be that they will be generic for adoption, expressing principles, and we can take these into consideration when we come to homologate circuits for events. But by the same token, these plans, be they for marshals, medical personnel, technical or other officials and participants in the event, we need to consider different arrangements potentially using these general principles for specific disciplines, because they will vary between permanent circuits and temporary circuits and indoor and outdoor events and so on. Okay, so another comment rather than question is not mentioned is lack of smell and taste. Yes, this is an emerging phenomenon where a lot of people who develop the infection are lose a sense of smell and taste. Having reviewed some articles to do with this is not specific to just COVID, but to other respiratory tract infections. But this is now felt to be more significant than it previously was, just as diarrhea and nausea and vomiting were felt to be important, then not felt to be so important and were removed from the diagnostic criteria, but now are re-emerging again as part of the potential symptoms. So I have a suggestion here. It would be good to develop guidance and protocols for ASNs, which in the motorcycle world is FMNs, the national federations, prior to organizing any motorsports events post-pandemic, and they need to comply to these protocols, including the local authority and country requirements. I absolutely agree, and I think as a national federation, the FIM can develop such motorcycle sport specific guidance and protocols. However, it would be up to the organizers, the promoters, and the national federations to liaise with their governments and their health providers and public health agencies within those countries, because the FIM could not possibly produce guidance for every single country in the world, and also the situation changes quite frequently. So I don't see a problem with us developing guidance and protocols in general terms for national federations to apply in their particular country, as is suggested here. So Ulrich has a question, which is, or again, a comment, not quite sure, but the protocol used in MXGP in Netherlands the week before the outbreak will do well also in the post-COVID era. Sharing is a good suggestion. And in fact, I was going to finish with that, but it's there in front of us. And that is, I have showed you, you know, an assessment, a risk management tool from the World Health Organization. If other event organizers or event medical service providers have already developed such tools, let's share them. And I suppose the FIM is in the best place to share these with our national federations. And so if you have them, I would be very happy to have that coordinated through the medical department or this relevant sport commission back at the FIM in May. And even though the office is closed at the moment, as required by the Swiss federal government, we're all still communicating by Zoom and by email. So we could collate this and use it. So thanks for that, Ulrich. Much appreciated. So now let me just go through. Okay, there are a few more questions coming up. So, question: what is the safest way to organize an international event 6 months from now, considering all the protective measures? No spectators, no brainer. Minimum staff from promoter and teams, perhaps. Keep in mind, if it's eliminated from one country, it can still exist. So I think we have to be prepared for it. I cannot give a definitive answer. No one in the FIM, no one in government can give a definitive answer in this. Therefore, I think we should be prepared for this. We should be planning for it. And considering all these things and more that I have mentioned, because it's much easier to relax any restrictions than it is to try and ramp them up at the last moment. So I think we have to keep in mind what is happening in a particular country and even in a particular region of a country. And I know from the communications that I'm receiving that our promoters and our organizers and our national federations are already engaging with national and local governments to learn what they require and what we need to put in place. And I also know that this is something that Formula One is also dealing with and doing in preparation for the resumption of their season in countries like Austria, for example. Okay, now, an issue: people don't recognize each other. Now, Aldrich, thank you for that comment, but I'm not quite sure what you mean. I'm thinking, unfortunately, we don't have the facility to chat, but the problem with people wearing face masks and you can't recognize them. Yep, I agree. Apparently someone has invented an app with face recognition. And I know that in some of the hospitals I've been going to with the ambulance service, people are actually putting pictures of themselves above their name badges, and also are putting writing their name on their face masks. But I hope that kind of answers that. But we take that on board, and you know, it would be another consideration to get people to wear name badges or indeed pictures of themselves to overcome that. And thank you, Mohammed, for your offer of every support from Kuwait. Thank you for that. Really appreciate it. Okay. Next one is, how is the social distancing feasible? Or how feasible it is or can be considered? Well, at the moment, I think we have to. We have no choice. There will be some countries where it may have been relaxed by the time we have an event. That's a good thing. And if we have a relaxation, that makes it easier, but I think we should prepare for it and consider it, even up to and including the the events being run behind closed doors. But that's a big consideration for organizers and promoters. But we have to make an effort on this one. Okay, question from Barry. International events involve extensive travel from many different countries. Do you therefore expect that national events will be able to resume sooner? Potentially yes, is the answer. Certainly in Ireland, we have had none, none are planned. But I was talking to a colleague from Australia recently, and their restrictions are being eased, and they have fewer cases, and in some areas none. And so it's quite possible that their national championship, I'm not saying it will, but it's quite possible that that may resume much quicker than international events. But that would have to be on a country by country and even region by region basis. Now, please let us know if there are any task force to review post-pandemic plan for motorsport. I am willing to contribute. Cheers and take care. Honest answer, I am not aware, but I think that is an excellent suggestion. Certainly, I would say on behalf of the FIM's Medical Commission, we are very happy to contribute to this, but we would need input from various sources, sport commissions and others around the world, from our federations and so on. So I'll take that one forward back to the FIM, and Mackie may pick it up in his closing comments. So I think I'm going to have to think about a question about antibody and serum testing 2 weeks prior to the event for participants, and participants recorded as low probability of becoming ill. Yes, that is a possibility, but I think we would have to be guided by international organizations. I know that there are some concerns about the reliability of antibody testing, and we'd need to be sure it was a reliable test, and that it was done in such a way that and at such a time that we can get the results back, they are reliable, and that people are not then going to get affected in the interim. But yes, that is a possibility, and as I mentioned, we want to avoid ill people traveling, and particularly traveling internationally. Does this COVID-19 situation bring us to thinking of increasing or adding the medical specialty in motorsports too? Yes is the answer to that. I think we should do this. I think coronavirus and COVID have focused our attention, but I think there are other issues that we need to consider, other similar issues with other conditions that arise from time to time and may indeed arise in the future. From what we read in here, it seems that motorcycles can be recognized as an ideal form of transport in the after COVID-19 era. Would you agree? Yes, I would agree, because you can ride alone in the open air and be separated from people rather than in a bus or in a car. So in principle, yes, although I did see a photograph today of a motorbike in Asia that was driving around the city disguised as a large virus to remind people about social distancing. And indeed, colleagues from Asia would be very familiar with this. Vast numbers of motorcycles congregating very closely together at traffic lights and junctions. And yes, in principle, motorcycles, yes, but social distancing would apply there as well. So if the situation is getting better and will release the lockdown, then we will organize the motorcycle racing event in the next few months at national level. Do you have any advice about the protocol for medical safety checklist and protocols? Yes, and as I've said earlier, we're quite happy to develop those further and to circulate them for you to use. And as before, if anyone already has them and are prepared to share them, be quite happy to work collaboratively. So, would injury to a rider during our event requiring hospitalization be a big concern, as the injury will reduce his immunity? Will we be compromising on rider safety? Absolutely, we will not be compromising on rider safety, nor the safety of the responding medical personnel. And that is why I have suggested that we liaise with the healthcare providers in that locality to ensure we have arrangements in place for the entire rider's journey if we have an injury, and not just for the rider but also for the people who are treating them. So I'm going to have to finish fairly soon. So the FIM CMI, that's the Medical Commission, should create a COVID task force looking at all the aspects with standing operating procedures and contribution of motorsport manufacturing units and so on. I would agree. And we're happy to work with other international organizations, including World Health Organization, in relation to a number of aspects of this. Quite happy for us to lead on that, but we'll need people from our sporting disciplines and from international organizations such as World Health and others, as well as assistance from and input from national federations. So I very much take that on board. Okay, so we get to the last couple. I know gloves are good to prevent non-affected persons, but if affected person wears it, he can touch people. Is absolutely right. And the World Health Organization would be not to wear them as a routine, but wash hands, and also wear them if you are dealing directly or caring for someone with the infection. But that is the international advice. Would esports be an option? Formula One did one. Well, I'm not the most technically minded, but I would give it a go. It'll be my only chance of competing in and potentially winning, not a MotoGP or other motorcycle race. There is a thought. I'm sure some people in the audience would have the wherewithal to make that happen. I will leave that with them. So, finally, and then I hand back to Stephen. As petechial lesions with oedema are becoming noticed in many infected people in their extremities, could this be one of the screening criteria if there is no testing evidence? Yes, and we have to be alert to the fact that this is an evolving situation, and advice and guidance that was in place even 1 month ago has been superseded, and updates are regularly being provided. And this is not a static situation, and we have to be alert to changes in guidelines and protocols and diagnostic criteria. So your point is very well made. So with that, I will have to finish. I see that Stephen has come back online again. I thank you for your attention. And if you have any further questions or comments, please do not hesitate to send them to me by email. If I don't know the answer, I'll try and find it out for you. And so with no further questions, I'm going to hand back to Mackie for some closing comments. So thank you very much for your attention, and I look forward to working with you all to get us all back on track, hopefully in the near future. Thank you very much.
Thank you very much, David. You hit the nail on the head. You just answered a lot of questions in my head. And for sure, with all our listeners out there, you also gave them a very good picture of the scenario we find ourselves in. We should be heads up in our unlocking of the countries. But of course, the governments have their own politics and policies. We have to mind the flow of the curve. in United States of America today, they have opened non-essential businesses. I don't know if it's like putting gasoline to the fire, but it may create a second wave or third wave, because it's quite too soon. Although this is a good example, and other societies are observing the states in America to the conduct of how they are unlocking the situation and leapfrogging into a free society. We should at least write off the first 6 months of this year for motorsports. So we're on our 5th month, and one more month to go probably. And hopefully by the 4th month of this year, we shall resume racing. Although, as I say, currently the government policies require a lot of hindrance to our events, and which we should respect. And as we are standard law-abiding citizens, I need not say the other states, apparently President Trump has already congratulated and supported their movement, wherein his initial plan was to lock down for 2 months. But last night he's encouraging them. Of course, international travel means a lot for us as we are international events. And some countries have an isolation quarantine procedure. In our FIM Asia social chat Zoom 2 days ago, all the China cities, countries are on a quarantine on mainland China, Hong Kong, China, Macau, China. Whenever you enter these Chinese countries, you need 14 days isolation, not in your home, but in a proper quarantine hotel facility, because China is opening its doors now. So is it good to have all our races in China? But to stay there for 2 weeks is quite a challenge too. But maybe have 2 events back to back. Oh, this is just for discussion. And we shall await more from the government of China with regards to international travel. And their figures as well are quite interesting. And we should observe all of these. The strengths of staying home include the development of online internet activities, such as how we find ourselves in now in our Zoom meeting. Previously, it was Skype, and now we have different forms of platforms. We have digital sports. Yes, we have observed this. We have the FIM Asia has contracted a promoter to launch the FIM Asia Digital Moto Championships. It's called the FIM Asia DMC. It's on a Facebook page right now. You can check it out, FIM Asia Digital Moto Championships. They have been writing this platform base for 6 months. We've signed the contract already. But it is on a testing phase now on Android games in 9 countries. So if you have an Android phone, you can try to check it out and check the Facebook page for more information. As of yesterday, the iPhone Apple platform is being worked on. Yes, so we're not riding on a ready-made game, but we are reinventing our own platform, and eventually we shall have the continental championships as well. We will get 1 champion per country, and all these riders of the electronic games will meet at the final game. We shall also forward this to some continents so they can make use of. It is side-by-side racing, and you can dress up your bike accordingly. You can get soft tires, you can get racing exhausts, racing fuel, and it's quite interesting and very well invented by the promoter. That's the FIM Asia Digital Moto Championships. Our world statistics of this virus figures will still go up. At the moment, it is at 2.86 million. And 187,330 deaths as of today. Getting more tests is the key to the future figures. There are still silent carriers of this virus out there. And without the millions of tests done, we shall not know the real figures. And then after, it is up to the government to set the proper policies into place. In the future, in the unlocking of society, it's supposed to be done sector by sector. Of course, the non-essential sectors have been starting to open in America, and we shall see how they do. And we have to create now a new normal way of life to conduct society living with the virus. And it should be okay. the race of the premature opening of non-essential businesses shows the human nature would like to continue with life, especially due to economic pressure. Georgia, Texas, and Carolina are opening up their quarantine, and hopefully in the near future, life shall go on in the last 4 months of the year. The economic aspect of racing is quite important as well for us to open the doors. The race organizers have been given contracts by their sponsors to deliver an X number of races. The racing teams and the riders have been contracted as well. The racing teams have been provided a contract from their sponsors to participate in X number of races, and this has to be entertained. We wouldn't want them to refund the money and pay them back, because this is their way of life and way of living. It's very good news that the Oxford University, through the Oxford Vaccine Group yesterday, for the first time, tested immunity vaccination on 2 persons. They said it will take till September to try out the results. They are looking for more volunteers for this test, and it looks quite encouraging. A question was asked, though, if they can give the SARS virus to these persons that have the immunity shots. Although the directors of the vaccine group has told them that they have not yet figured a vaccine to solve the coronavirus. That's why this is quite risky. But they are seriously into this, and instead of years of research and development, they have fast-tracked this development to under 3 months. Google and check it out, Oxford Vaccine Group, and we wish them all the best. By September, they plan to come out with 1 million vaccines, but we're over billions of population, and another question is how soon can we get the vaccine? So let's prepare to go to war and live with this invisible virus. The personal protective devices will be mandatory for the future, for our events, and for society, with the priority of safety and its parameters. Some facts and figures that I have recently gathered. There was a flight yesterday from Taiwan to London, and in the Airbus 300 and the flight of the A300, there were only 30 personnel, passengers, and they had social, physical distancing. You're not allowed to choose your seats. You cannot book online, and the check-in counter shall arrange your seat accordingly. We have gone into the social media meeting. Our next board meeting, which was scheduled in Czechoslovakia in Prague on May 20, is now converted into a video conference. And an interesting question is our General Assembly in Monte Carlo, wherein we have the Rider of the Year awards that shall be discussed, and hopefully a plan ABC shall be in place for this. Excuse me. Of course, for circuits and events, side-by-side sitting, we should take care of this. But venues with outdoor seating may be interesting. As we have seen in some circuits, you have open fields, and we can practice physical distancing for our events when the time comes. For indoor sitting, as we see that we only have stadium events, such as the X Trial and all, physical distancing is needed as well. Yesterday, the German UEFA Bundesliga Cup has encouraged to start on the first week of May. They are seeking the government permit with a limit of 300 people in the stadium and no spectators. And each of the participants shall be tested weekly in order for them to finish their national league. They shall not be taxed. They shall not be taxing the virus self-test kits, because the numbers and the availability of this are quite easy to come by now. In the United States of America, the World Supercross Championships, we have read an interesting article that they plan to start soon in May as well. They just plan to stay in one stadium in Arizona and have 2 events a weekend. They got stopped at their round 10, and they're supposed to deliver 16, 17 rounds because they have accepted sponsorship contracts for 17 rounds, so they're forced to deliver. The remaining 6 or 7 rounds, which shall be held in Arizona in Phoenix Stadium on a Friday and a Monday, due to the live telecast availability of the television with no spectators. And they are still seeking the government permits accordingly. And quite interesting, each round will have a different design of the circuit since it's a dirt track and they are easy to move the dirt around. There was a question with regards to motorcycle and public utility. We have a very big telephone application called Grab in the Philippines. And they have motorcycle taxis wherein you input the need for a motorcycle ride and they come to you. Unfortunately, this has been suspended by our government regulatory board due to the fact that if you're back riding with someone, stranger, not he's a stranger and he's not within your immediate family, any droplets that may occur to him can instantly go to you. So it is a challenge as well for the mobilization of people, since it's a very good traffic alternative solution. So thank you very much. I see a lot of friends out there listening. Hello, Europe. Hello, America. Hello, Asia. Without much further ado, I thank you so much, ladies and gentlemen, from FIM Asia for joining us today. Remember, FIM Asia cares. And David, I look forward to seeing you soon in our events as well. Thank you very much. Thank you, ladies and gentlemen. Ciao, ciao.